Welcome back. I'm Alan Mendelson. This is Best Buys, Deals, and More on 790 KABC. Every Sunday morning, please watch my TV show, Best Buys with Alan Mendelson, on KCOP Channel 13. My website is alanbestbuys.com, alanbestbuys.com, alanbestbuys.com. You know I have to spell it out because of all the copycat make-believe websites out there that try to steal my web traffic, and shame on them, as I like to say every week. We're at the office of Dr. Danielle Affiero, the OrthoHealing Center in Los Angeles. And we've been talking about sports medicine and a procedure they use here to draw the patient's blood, whip the blood around in a centrifuge to consolidate and collect platelets, and then inject the platelets into sites of sports injuries of the same patient to heal the sports injury. How many treatments do you need?
So it depends. If the injury is less than 3 months, you typically can get away with 1 injection. If it's more of a chronic problem and more severe pathology like tearing, then you might require 3. They're usually done 1-month interval apart.
We've been talking about sports injuries, but this treatment also applies to other types of pain and illnesses?
Yeah, so other than sports injuries, there's also arthritic conditions that could be helpful for, where we're basically strengthening all the supportive soft tissue around the arthritic joint, as well as making any residual cartilage more resilient by strengthening it up and making it more firm. It doesn't actually grow new cartilage, but it will make the pre-existing cartilage stronger, and it'll strengthen all the surrounding structures around the joint. Lots of times we'll combine it with viscosupplementation, which is a gel that mimics human cartilage. This is covered by insurances, and we'll inject the gel into the arthritic joint as well as the platelet-rich plasma therapy into the joint and then the surrounding structures.
Is it painful?
It is uncomfortable. It's not that much more uncomfortable than a cortisone injection while you're getting the procedure. It's the aftermath where you expect it to be sore, you expect it to be tight, painful, swollen. Like I said, we're basically mimicking a new injury. So patients will walk out, usually everyone gets pain medications for the first couple of days. You're not allowed to take anti-inflammatories a week before or after because that's what we're relying on for recovery. We want the body to go into an inflammatory status because that's how we heal. So the more anti-inflammatories that you're doing, that's taking away and negating the effects of the procedure.
It's like fighting fire with fire, huh?
Yeah, exactly.
All right, so you've been doing research now on this in this country. Not only you, but others have been doing it. What's the progress on the research to the point where, the FDA says it's cool and insurance companies say it's cool?
Yeah, so the problem is that, like I said earlier, a lot of doctors are doing this procedure in all different styles and techniques, with ultrasound, without ultrasound. What kit are you using? Are you concentrating your platelets 5 times, 10 times, 23 times? There's so many different variabilities, as well as the actual technique itself. There's no specific training for this. Doctors are learning this as they go. There's no formal training. Residencies are not teaching it. So the problem with the studies is that they're not very well controlled. Sometimes they'll use to compare the PRP, they'll use another treatment to compare it to. So in one study, they decided to compare it to just dry needling with normal saline in an Achilles tendon. So now the problem with that is that, number one, when you dry needle an Achilles tendon with normal saline, that in itself is acting as a stimulation to then trigger the body to heal. That's number one. Number two, one of the criticisms is that the platelet-rich plasma therapy that they used was so liquidy, it spread everywhere. So you couldn't control where the PRP went. When you do it under ultrasound, you don't have that factor because we see where it spreads. You put the ultrasound on a certain Doppler mode, you see the PRP spreading. We know we're getting to the site. Also, some of the kits that you use, it comes out like water, the PRP. So the kit we use is highly concentrated. It's so viscous, it feels almost like you're pushing a gel.
So it seems to me someone's got to come up with some standards here for how this treatment is worked, how it's developed, how it's delivered, and how it's tested. We're not at that stage yet? Everybody's doing trial and error all over the place?
Yeah, that's where we are. This is the beginning phase of this era of biologics, it's called, where we're utilizing the body's own natural healing mechanisms to heal. And it's a new era. Everyone's been relying on surgery, cortisone, and physical therapy. That's the mainstay of how you treat pain. They fail physical therapy, they get some medications. They get medications, they get surgery. And then there's nothing left.
Well, it sounds to me like we're wasting a lot of time here with everybody going off in every which way direction, trying to come up with their own treatment option here. Why can't somebody coordinate this thing and we get it approved quicker and we find the correct way to do it faster, and a lot of people will be having less pain in the future?
Yeah, well, that's the process we're in. So all different centers throughout the country are working independently, doing different studies, collaborating. We're actually we've collaborated with Italy. They're doing a study with PRP in the knee with the gel injections, and we have other potential studies going on with other doctors in the world to try to collaborate and get information. But it's the same phase that, with antibiotics. So what happened with antibiotics? And this is the baby phases of it. We're not at the point yet where we could say with any uniformity, this is the treatment that works for these specific diagnoses when you do it in this manner. It's all still new.
Is this why it takes so many years for new drugs to come to market?
Yep. At the same time, the good news about that is that when it actually does finally get approved, which it will, is that there will be no question. It won't, there won't be a question of, well, that study, this was the problem, or this study, this was the problem. It's all very strict and rigid. So that's part of the United States where there's pros and cons of being like that.
Is there a guesstimate as to when this will finally get, final approval?
I mean, I would anticipate probably within the next 5 years. That at least one or two insurance companies are then jumping on board. But I would say that would probably be the minimum, 4 to 5 years.
That could be a lot of money spent and a lot of hurt involved in 5 years until it gets approval. Huh?
Right, and then that's why at our facility we're not just we don't just do the traditional based sports medicine and only PRP. We have a whole spectrum of other available treatments that are creative and will be able to get worked through the insurance program.
Okay, what else do you do?
So like I said, we treat arthritis. So we do the gel injections into various arthritic joints. I do prolotherapy, which is the sugar injections, which actually works really nicely in strictly ligamentous problems, like people who just have recurrent ankle sprains or a slipping rib where the rib is just coming out of place. A joint that just tends to be a little bit weak and unsturdy. That's prolotherapy is the perfect candidate for. We do therapeutic Botox for patients who have a lot of muscular pain and muscle spasm. And when trigger points just don't do the job, trigger points is just going in with a little lidocaine and doing a trigger point. I go in with Botox under ultrasound guidance once again and force the muscles to relax, which could be very effective in neck pain, headaches, and TMJ dysfunction. Also, we do, we have other adjuncts such as we do gait analysis with orthotics. We do trameal injections, which is a naturopathic herbal extract. People always know about it from creams and ointments, but we actually have injectables that we can inject into various structures.
Now, are these all experimental, or some of these approved by insurance?
Most of these, except for the trameal, most of these are covered. The Botox is covered. We do prior authorization for everything, as well as the viscosupplementation. Prolotherapy is in the realm of the platelet-rich plasma therapy biologics, so that is not.
That's fascinating. All right, Dr. Danielle Alfiero of the OrthoHealing Center. Let me give you the address. 10780 Santa Monica Boulevard in LA. The phone number 310-453-5404. 310-453-5404. Their website, OrthoHealing.com. OrthoHealing.com.